What are some of the challenges that you face when you're bringing all these different stakeholders that historically have not really worked well together and getting them to forge these one-of-a-kind partnerships that have never historically existed?
That is a challenge that we face, and you have health plans that are competitors in a market, and we say to them, look, like, you guys are all plugging into the same network to provide ultimately services for all of your members. So you can help us build out this geography and this network, and then, your 3 next competitors in the state were also going to plug into this very network. So I think it's about, we do think of our customers as partners, and I know that may sound trite sometimes, but I hope they think of us more than as vendors, but really as sort of as working together to build this social determinants of health space that didn't exist, 5-10 years ago. And as we do it together, we listen to their feedback. They listen to sort of our experience working across the country. So if they're regional, they're based in California, Nebraska, and so they understand their region. We have obviously national experience that we can bring to the table that helps them think through some of the challenges. But yeah, I think it was a challenge. I think they understand that working together in this area will get more people the help they need. So I think there is some of that in there. So obviously they're competitive, but I think they're also ultimately, they are trying to help their members, be healthier. And I think they see that working together will yield more results to do that. So, and their memberships are constantly changing and evolving. So, I think we did certainly we started the conversation being asked to build siloed networks, for sure, like you said. And I think we've moved past that, and I think hopefully we're at a point now, I think we are, it's been 2-3 years since we've been having those conversations where we can, I think people are comfortable with this model now where they do all work together in these areas. And perhaps they have communities where they're stronger and they have community partners that they prefer, and we bring those onto the network for them. But ultimately everybody can refer to those community partners, and it makes the whole network stronger. So, and then we have one platform across the country, one instance. So any feature that any one of them suggests to us, and we take all their suggestions super seriously, we build into the platform and we roll it out across the country. So there's no single feature that any one payer or provider has that others don't. But they've been, I think to their credit, they've been great, and I think they understand the mission, and I think they see the impact of having these measurable outcomes, and I do think that, ultimately, I think we're all aligned that we want to help people get services.